I'm Hannah Lam.
I'm Sofia Gosain.
And I'm Shaniya Thomas.
And we're the creators of Helpioid.
Helpioid is the app that will change the way the world views the child opioid epidemic. Nearly 9,000 children and teens have died in recent years due to opioid poisoning and abuse, which is nearly triple the amount of deaths in previous years. Our app, Helpioid, will help combat opioid addiction in children who have recently undergone pediatric surgery. The opioid crisis is an epidemic occurring because of opioid abuse and overdosage. Patients often receive opioids for their injuries, and by the time the pain has subsided, the patient has formed an addiction. Some adolescents face peer pressure and are forced to succumb to the great danger that is opioids. In certain cases, the addiction carries into adulthood, which leads to more difficult to treat addictions.
The purpose of all of this is to help prevent and stop further opioid addiction in children who have recently undergone pediatric surgery and may be abusing their pain medicine. Because patient and supervisor accounts are linked, more progress can be made since more about a patient's situation is known. Helpioid is easy to use for parents and supervisors too, not just patients.
This is our app, Helpioid. When we were first building our app, we made a prototype to plan all the screens in our app. Then, using MIT App Inventor, we created our app. Our app contains almost all functionalities of our project and can be enhanced. When a new user uses the app, there is a registration process in which they submit their name and doctor. Once they have submitted this information, they will now submit a code they receive from their doctor. Once all of this information is received, the user can begin using the app. The patient side of the app includes a check-in to update physical and mental health. The check-in allows the patient to input their emotion, the doses of medicines they've taken, the water they've drank, the hours they slept, and the hours they've exercised. The check-in also includes a journal entry space where they can write out their thoughts and feelings. The app also includes a chat with the patient's doctor, meditation guides which are updated regularly, as well as phone numbers to call in case of emergency. The supervisor side of the app also uses the same procedure for registration. The supervisor side of the app allows the supervisor to read through the patient's daily check-ins, instructions to follow in case of emergencies, and phone numbers to call. There can be many more enhancements to our app, such as keeping history dosages and using a web database that can be accessed by the doctor and the hospital.
We believe that Helpioid will be a force for great change in the future. Thank you.